Welcome back. The Obama White House is negotiating with congressional leaders over how to pay for health care reform transition costs. One idea the president is apparently willing to consider involves a tax on employer health care benefits. And that takes us to tonight's Hypocrisy Watch. First, the background. President Obama again today urged Congress to take action on health care reform. He told an audience in Wisconsin it's an issue that cannot wait.
For we've reached the point where doing nothing about the cost of health care is no longer an option. The status quo is unsustainable. If we don't act, and act soon, to bring down costs, it will jeopardize everybody's health care. If we don't act, every American will feel the consequences.
Last week, the president spoke with key senators about the competing congressional plans and on how to pay for them. Following the meeting, Democratic Senator Max Baucus, chairman of the all-important Finance Committee, said the president was leaving the door open to taxing health care benefits.
We all are flexible on all these points. The president is.
President Obama flexible on the issue of taxing health care benefits. Well, that's interesting because during the presidential campaign, Republican presidential nominee John McCain put it on the table as part of his plan. Senator McCain proposed mixing in a health care credit with a tax on benefits. And Mr. Obama, you hammered Senator McCain for it. Remember?
So when you read the fine print, it's clear that John McCain is pulling an old Washington bait and switch. It's a shell game. He gives you a tax credit with one hand, but he raises your taxes with the other. And recently, after some forceful questioning on TV, he finally admitted that for some Americans, those with the best plans, his tax increase would be higher than his tax credit. So they'll come out behind.
They will come up behind, and taxing health care benefits is a bait and switch. Mr. President, let me be clear. Your administration has made a strong argument that our nation needs health care reform immediately and that it needs to be paid for. Furthermore, to bring in some of the necessary revenue, a good argument can be made for taxing health care benefits. But again, last October, you pummeled John McCain for suggesting exactly that, a health care tax. To keep the idea on the table now after campaigning against it, that's hypocrisy, and it's wrong.